Because of the wearable and smartwatch revolution, because of how accessible data and technologies are becoming due to global supply chains and social media, the trend I see is that patients are becoming the point of care. It will be a concept, and the concept is called patient design.
For our 100th episode of AI in Healthcare, we have a very special treat. And it's really taking a step back and thinking, okay, we've heard all kinds of things when it comes to what the world's going to be and how it's going to be and what's going to be required, and we should be so excited. And if any of you feel some kind of overwhelmment about that, that's actually a very normal thing. And I learned that from our extremely special guest today, Dr. Bertalan Meskó, who is from Hungary and the medical futurist, one of the first people that I started learning technology and AI from way back in the day, as his real focus is to say, how could we best prepare for not the future, but the potential future? And the way you prepare best is to know what all the different potentials are. So with all of that said, my name is Dr. Sanjay Juneja. I'm a hematologist and medical oncologist, as most of you know, and I could not be more excited to have you today, Bertalan.
Thank you so much for having me. Plus, you didn't tell me that it was such a special episode. I'm getting nervous now that we have to do a good job here, to celebrate this 100th episode.
No, I mean, you couldn't be more fitting, because I can only imagine, only since I've made it a thing, just like oncology studying, to also be aware and abreast of technology and what the, consequences are or could be, how overwhelming it is. Like, it's truly, the pressure is pretty intense. And that's why the book that you had sent me, Your Map of the Future, has been so unbelievable. And in the sense that it just kind of gives you that idea of horizon scanning and all of the different tools that you spend a lot of time looking into to say, hey, let's take a step back, make sure we don't get overwhelmed. And you don't need to be an expert to be prepared and to be cognizant of what's ahead. Tell me more about this on really kind of, I think you turned 40 years old and said, hey, I, want to equip everyone. You don't have to be, everyone has the potential to be prepared for the future.
Absolutely. In my career in the last 20 years, I've been dealing with trying to describe what kind of future we would like to build for ourselves in medicine and healthcare. I've looked at the evolution of advanced technologies, from digital health sensors and wearables to artificial intelligence, now generative AI. I have published studies with great collaborators across the world about how to implement these technologies, how to regulate them. So I've been using all these methods throughout the last almost two full decades in trying to find out how we can help decision makers, policymakers, governments, individual physicians and patients better prepare for what's coming next. And as I turned 40 last year, I had an idea that why it's only futurists, why we are only talking about like think tanks and major organizations and consultancy companies that can perform such analysis. And I thought, I've been using more than a dozen futures methods for many years, and I think there are some of them that could be absolutely translated into terms or into exercises and methods that literally anyone can learn. So I spent the last 1.5, 2 years trying to find out which of these methods would work best for a general audience. Nothing about medicine and healthcare this time, just a general audience, people who are either excited or curious about the future, and or people who might even have like fears or anxiety about what might come next. And I try to prove them the point or the notion through this book, Your Map to the Future, that the real quest we should have in mind is not to predict the future, because that implies that there is just one future. And as a professional futurist like me, I should be able to tell you what is going to happen exactly when and how, and that timeline should be described in detail, while in fact multiple futures exist. And these great methods are very helpful in observing and analyzing those potential futures, even choosing the futures we like the most for our community, family, even profession or field of interest. So I try to translate these methods into a language everyone can understand without any kind of technical or scientific background. And at the same time, and maybe it's a brave thing to say out loud, at the same time, I wanted to initiate a public conversation about describing and thinking about the future in a different way. Maybe as confidently as we can describe the past, because of how many years we have spent in our lives thinking about the past, learning from the past, going through stories and legends and studying history through history lessons in primary school. But what about the opposite of all that? What if we don't get any kind of education about futures thinking, if we think the future will just happen with us and at us and it will come at us and we have no impact on all that, then of course, how can we be optimistic about the future if we think we have no say in all that? So it might be a lot at first, but these are the major points I've tried to change with this book.
No, I love it. And, the same way that I had a lot of fear when I really sort of started education on social media about updated guidelines, for example. It's like, okay, we learned something in cancer that can get better care, but we know there's a huge delay in people getting to receive and benefit from that understanding, discovery, etc. You can take that same concept and have anxiety about the fact that technologies that could truly improve the lives, at least from a healthcare aspect, but even beyond that, those technologies can be unduly or unnecessarily delayed, and people can actually have a longer time before reaping some of the benefits and having a better quality simply due to either writing it off, fear, overwhelmment, etc. So is that a fear that you have, or is it more so, optimistic in the sense of being best prepared?
It's not really a fear. It's more like a scientific gap. I like to believe that I have identified with my colleagues. And is that, and let's stay with your, favorite field of interest, your topic. If you look at any major opinion piece from a key opinion leader in oncology research, if you look at any original study about a very specific part of the huge, really vast amounts of data and information in oncology, and you will try to scroll down to the end of that original study or the end of that opinion piece, you will actually find insights, perspectives, opinions about the future. The authors of the original studies will write about what kind of future directions could be useful, how to, continue this kind of research. So it's a sort of a future perspective. The key opinion leaders and professors are usually invited by major medical journals to share their perspectives and their future visions about the next steps or scientific directions in oncology. But if you think about that, each of these perspectives or insights are purely subjective. There is no systematic way behind all that to make sure that, well, we have used science-based methods to make sure that all these visions or scenarios could be diverse enough, that could be based on evidence-based medicine, because there are so many studies about how to use foresight methods for such purposes. So the point where I sort of got fed up with the whole way of thinking about the future coming from the community of scientists is that the future visions shouldn't be based on subjective opinions only. It should be based on a systematic use of futures methods. And that was the point when I started to write studies with my colleagues about, well, what kind of futures methods have been used across all life science and medical specialty fields in the world. And we found that at least about 15 or 20 methods have been used quite extensively, but there are huge amounts of unmet needs and niche areas where futures methods, where foresight could play a major role. And I hope you don't mind, sorry for the long answer, but there's a very specific example in mind. When ChatGPT came out, the first big example of generative AI, and hundreds of millions of people, including patients and physicians, started using it, I teamed up with Eric Topol. Nobody has to introduce Eric Topol, the biggest scientist in the world of digital health and healthcare AI. We teamed up and we wrote a paper about how to regulate generative AI-based medical technologies. And even in that paper, I wanted to make sure to include the future iterations, because current generative AI agents can deal with text-based prompts or discussions. But what if, or how about those future iterations that will deal with images, videos, even sound, besides text-based information? What should a policymaker keep in mind today to get ready with guidelines, medical guidelines, protocols, and even policies and regulations about those future iterations? Because as you mentioned, technology progresses at such an unprecedented pace that patients and physicians just cannot wait anymore for regulators to get ready to understand all this, because now they have access to these technologies. That's very different from what we had like a decade ago, when you had to wait for an artificial pancreas system to be rolled out onto the market, being regulated and safe. But what if a patient can access the same technology through a blood glucose sensor, through an insulin pump, and an algorithm running on the cloud through a smartwatch without any regulator? Of course, it's not something we want to achieve, but that's something that's possible now. So there's a time gap between what policymakers should be able to regulate immediately and what patients and physicians will get access to. And I think this is the part that is unprecedented in the history of medicine. And that's why we have to extensively reach out to futures methods to make sure that by the time these innovations become real and accessible and rolled out to the market, guidelines and regulations will be in place.
You make such a good point, especially when you kind of made the example of a key opinion leader with something purely subjective based on several objective data points. What does that necessarily do, that subjective opinion? Whereas what I take away from you is this concept or thought of trajectory. Like, if you could just see the trajectories of what we do know and then what is possible in these different, scenarios, that's where preparation is most had, because you're able to really kind of predict the trajectory. The same way that there's all this global climate study, and then these tectonic shifts of the continents. You look you look backwards, and then you say, okay, where and how do I predict forward? If you want to get even more variable, it's kind of like a military practice, where you're kind of like learning and studying, and this is for hundreds or thousands of years, how certain populations or civilizations or countries are, how are they moving? Where do they get their resources? This, that, and the other. The same thing applies as a resource to technology. And what are the pain points and problems? All of that to say, it makes so much sense when you think of it in that capacity. And I'm a little embarrassed. It took me, reading about a quarter into your book to really appreciate or recognize that. I guess my second question is, when you talk about predicting the governance and all of the things that are tangentially or directly related to the trajectory of what technology can offer, one of my mentors, Mika Newton, he's actually the CEO of Xcurs, he said, Sanjay, there's a reason that you like AI people. And I said, why? And he said, because you studied philosophy in undergrad, right? And I said, yes. And he said, well, that's what AI is. A lot of people that are in AI is you have to be, to some degree, philosophical to, have even conceive the what ifs and the whys, like, taught to think. People said it was purposeless. So how does one do that? Or is it a favorite method of yours? Or if somebody didn't study philosophy, how do you start conceiving things that are not yet, today?
It's an exciting question, because I started smiling because you cannot pinpoint one person is further away from philosophy than myself. So quite definitely I'm not doing it through that way. But as a futurist, I think my job is to be able to zoom out, to look at healthcare's progress or transitions or paradigm shifts from a bird's eye perspective, and then, if needed, zoom into a very specific field, like the specific progress of generative AI for medical students on the same day. That's the part I enjoy about my job the most, to be honest. But to zoom out, I think that's a muscle that actually you can work on. That's something you can get used to. And I started doing these futures exercises with medical students and PhD students too at my alma mater, my medical university. And my experience, the more we do these exercises, the better the students get at it, because that's a muscle you can work on. To be able to zoom out, you have to be able to consciously leave your day-to-day challenges, tasks, issues on the table, and try to look at the changes that the system has been experiencing from a further perspective. That could be like a few months or a few years, but this gives you like a clarity about understanding the reason why certain technology doesn't get implemented fast enough, or why something else is being overhyped by everyone else, because you constantly try to zoom out day by day and look at all these changes from a bird's eye perspective. So where I see the biggest value as a futurist's contribution to like a government's policies or guidelines or a medical association's work is to pinpoint trends which are not about technologies, but about the long-term cultural outcomes of using advanced technologies. So I think, to be specific here, I don't think that just saying that, look, wearable sensors will have a great role to play in the future of medicine has anything to contribute to the decision-making of a policymaker or a medical leader. But by concluding that, because of the wearable and smartwatch revolution, because of how accessible data and technologies are becoming due to global supply chains and social media, the trend I see is that patients are becoming the point of care. And I think that's such a rule of thumb that can be useful for a policymaker or a medical or healthcare leader, because just by keeping this rule in mind, they can think about new announcements or studies or technologies that they come across, whether that technology would be in line with this bird's eye perspective observation. If that technology is in line with all that, then it must be part of the digital health paradigm shift. So I try to, instead of pinpointing certain technologies people can be excited about, or I personally can be excited about, I try to or tend to come up with a list of observations that will help people have these rules of thumb in mind. So like patients becoming the point of care, or how digital health technologies make healthcare globalized, or how patients and physicians are becoming members of their own medical team. So these are the high-level perspectives I'm trying to find throughout my research and analysis, instead of just, overhyping or rejecting certain kinds of technologies.
I love it. It reminds me of Dr. Deborah Patt, who is amongst many things, the president of COA, Community Oncology Association, who always starts some of her PowerPoints on the path to nirvana. And I think what you're saying is really illustrating kind of what she means by that, which is think of the circumstances in the most ideal sense or scenario. Where do you want to be? What are the different components or pillars that make up this ideal future? And then see how congruent or in line any particular technology or solution may fit into that. If I may, and this is a little bit of a dirtier question, but one of the places I used to get most hung up on, and now I just take very seriously and include, at least in the United States with our healthcare model and everything else, is the economic factor. And I don't even necessarily mean economic for everyone, but for the for-profit factor, because that, to me, throws a wrench into this ideality. And I say to me, because now I'm thinking about the subjective key opinion leader. Let me put it another way. In history, backwards, we've seen that things have gone awry because of this model. Do you have concerns? And if not concerns, how do you address that? The components that are almost, certainties of what will be or may be, even if they are not in line with this nirvana, state or system.
I would try to answer that by using the methods that I usually use as a futurist. Because when I talk about these things, about challenges, economic or cultural, technological or HR-based, with government officials and healthcare leaders and hospital administrators, I always ask them, what is the future vision they would love for all of us to achieve that vision? What is the vision here? Because if you have no vision, that, what are we fighting towards? If we don't know the end goal of the whole story, what are we working on right now? And I think what very basic futures methods can provide these leaders with is an exercise or a practical process of creating such a future vision. Because if they know what future vision would be the chosen one, and they can also describe the utopian and the dystopian extremities of a range of visions, then at least we know what kind of scale we are talking about. Plus, if we know what vision, what future scenario we would like to get closer to, then we can also describe the potential advantages or potential negative like challenges or issues, bioethical considerations that we have to keep in mind while trying to take steps towards the future. So very specifically, there is futures method called scenario analysis in which I have an alternative version I like to use. In that, I sit down with leaders. For example, a few weeks ago, I sat down with leaders in the US of medical colleges, and they are the ones being responsible for how the future of medical education would unfold, what it would look like in a few years' time. And we have to describe one common value. And for us in medical education, the value was the professor-medical student relationship. If that relationship flourishes, then we have an amazing utopia. If that diminishes or vanishes, then of course we have a dystopia. And then I started asking them questions about, let's talk about those two extremities. Let's describe those future visions where everything goes wrong or everything goes like miraculously, amazingly. And then we have in between an idealistic but optimal, achievable, probable vision. And then we can even backcast. Well, here is the practical reality of today about that specific field of interest. We know what future vision we would like to get closer to. Let's talk about what potential steps we should be taking from now on to achieve that vision. Legal, technological, cultural, emotional, HR-based, any kind of categories can come in mind. The more steps we can list, the better position we will be in to have a higher chance to achieve that future. I think this is an extremely simple exercise to do. It's a very practical method to learn. It takes a few minutes to learn that. But it will at least give a sense to leaders about, we know where we are heading, we know where we are at right now. These steps must be important in trying to achieve, the next few stages within that process. I'm not saying this solves all these future problems. I'm not saying that it will change healthcare forever or any kind of field, because the book is not just for healthcare leaders in general, but it would definitely give a sense of not certainty, but a sense of anticipatory consciousness. That's what we like to call it in future studies. And I'm so glad that you said two questions before that. It's not about predicting what is going to happen, but you said this way we would be better prepared. Exactly, that's the goal. Nobody can describe what is going to happen. Some futurists have tried, maybe even based on data. Ray Kurzweil still predicts that the singularity might come in the 2040s, and that's all right. It's based on data and information technologies. But I believe in the importance of not trying to predict what is going to happen, but in describing potential future visions that would cover most of the potentials out there in the future. But by having these scenarios clearly laid out on a table, we can start talking about which ones we like the most, which ones we have fears about, which are the future scenarios that would make us like more anxious than the others. Maybe these are the ones we should spend more time thinking about right now. So what we get at the end is still not that we will know what's going to happen, but I guarantee you that we will better prepared emotionally, cognitively, even culturally for whatever is coming next. I think this is the value that futures methods can bring into any field of interest or profession these days.
I love that. I mean, it's funny enough, before I got your book, at Daniel Kraft's Next Med Health, there was a workshop where basically we envisioned the most ideal form of healthcare, like 15 years from now. And exactly what your book describes so well is okay, make 6 boxes. What are the scenarios or components of that system? And then what are the things necessary or happened in that 15-year interval to be the most ideal it could be in 15 years? And then you kind of really had to dissect and think about what are the, things that aren't happening? Why aren't they happening? But then what you just illustrated, we didn't get to or do, which is the second part, is what are the things that could go wrong? What are the things that would keep you or delay from getting there? What are the potentials you could see on why you wouldn't hit that target on that one pillar of the 6? And it's a neat exercise, and I think somewhat, behind this concept of, nodal mind mapping and things like that, to really kind of see how they all are tied together. Beautiful. With all of that said, I'm wondering, what is one method that seems to catch people most off guard, or that they are surprised to learn, that you've seen in your own anecdotal experience?
Out of the major futures methods I share in the book, vision writing is the one that I get the biggest amount of feedback about. In vision writing, what you do is you try to get into the perspective of someone in the future. For example, you are interested in like how art and culture could be intertwined with artificial intelligence. So you come up with an idea, a future scenario or setting that there is a festival with an art versus AI program, and your job is to write the agenda, come up with ideas about what kind of artists or what kind of AI elements of the program would make sense. And maybe we can even write the opening like keynote presentation of the head of this whole organization dealing with art versus AI, and you can write like a story. Also, I use the same method as a parent myself. I was thinking about whether I'm doing a good job as a father. We have an 8-year-old daughter and a 1-year-old son, and my idea was that let's use vision writing. So 10 years later, they are 18 and 11, and they are discussing, like they are talking about me as a father. And I have data on that because I have experiences with them day by day. And I started describing probably what are the stories they would love to tell each other about me, which could be the stories that they might tell each other, like something like negative aspects of me being a father. So I started getting a picture about what the future of my kids could discuss with each other about me being a father now. And the reason why it was helpful to me is that it gave me some clarity about what kind of experiences I would love to have with them right now, to make sure that in the future, they will discuss things that would at least make me feel like I did a good enough job as a father. And that's why vision writing is not a very, robust or very systematic kind of futures method. Forecasting, scenario analysis, the futures wheel are much more systematic than that. This is more about a narrative storytelling, that I get into the shoes of someone in the future, which is quite an extraordinary experience in itself. And that's why I was surprised in the first weeks after releasing the book that I thought the best I can do as a futurist is to translate a few basic futures methods into a language everyone can understand. But I started getting feedback from readers about not even talking about the methods, but the psychology, the section or the chapter about the psychology of futures thinking, because they found the concept of the future self to be far more practical than any of those futures methods. I was absolutely caught by surprise by that. What they meant, as I asked them to describe, was that just knowing that I have a future self, or more precisely, I have many future selves ahead of me, and I can make deals with them every day. Like I go to the gym today and I have so many things to do, but I will still go to the gym. And when I do that, I have this concept in mind that to myself in the tomorrow, myself in 5 years, they would love me for this decision. They would hug me and thank me that I still went to the gym for their sake. I didn't want to go that day, but for their sake specifically, I still did that. So actually, every day I started using that method years ago, that when I make a decision, like when I respond to an invitation, I have a quick discussion with my future self, or when I have many tasks to fulfill on that day, I start making a deal with my future self. Look, I cannot do all these tasks myself today without you tomorrow. I cannot give all of these to you, of course, that would not be fair. But I will take, 75% of them, but the rest will stay with you tomorrow. Deal? And then we go forward. And as I get into the tomorrow and to the next days and I become that future self, at least I knew what kind of deal I could strike with my past self. Just one last story about this. Our daughter just got braces. And of course, she was worried about the whole process. It will take 1.5, 2 years. But I told her that just for a second, please think about your teenager self, who will be so grateful to you with a perfect smile and a healthy oral health that you did that sacrifice for her. And just when it's a bit harder to deal with the braces and all the things that come with that day by day, just for a second, please think about that teenager self who loves you for your decision and for your struggles today. And she told me she still had struggles a few days over the last 1.5 years, but every time her future self came into mind, and it sort of helped soothe her soul a little bit, and it felt a bit better. So that's That's how not just the methods, but maybe even the psychological concepts in the book can help. And there's one last thing here. I got a third kind of feedback about the book. It was about the games. I thought just for fun, I would include a few games like at the very end, maybe as a form of like a source of ideas for teachers who want to bring futures thinking into the classroom. And people love that. One is called Stomp the Futurist, in which there are two teams. One team has to come up with concepts that they think would definitely not change even a decade from today. Maybe if they're interested in transportation, they could say that even 10 years from now, everybody who wants to will have to learn how to drive a car. And then the other team's job is to go online, use generative AI, and find weak signals, do horizon scanning and find technological trends or cultural announcements or government officials' opinions that would contradict that belief that these things will certainly stay the same. It doesn't matter who will be right 10 years from now. What matters is that these people actively engage in futures thinking by doing this game or exercise, and by spending more time thinking about the future, they will be culturally and emotionally simply better prepared for whatever is coming next.
All of that was just so unbelievably beautiful, especially with your daughter's, story. It's funny because people actually, at least in the States, have this phrase they use, like, thank you, past self, or like, this is for my future self. We say that, and I don't think, because I've been saying that for years, but I don't think I really realized, I know I didn't, in the same capacity that you're talking about. One example is my dad, that, if he cared that his sons would know that they're the most important thing to him, like, he nailed it, because he makes me feel like that every day. But I missed his birthday, not because I didn't know his birthday, because I didn't know it was the day that it was the 22nd, which was actually yesterday. So I put in my reminder on my phone, and like this year I was like, thank you, past self. I can't afford to miss that. But that's one small kind of cute example. But in a bigger way, I learned my intern year in internal medicine. I made a deal with myself, and that was that I will give myself the grace of any mistake once, like fool me once principle. And I only do that if on the agreement that any time in the future, I won't make that mistake again. And so in even though this is more retrospective, like, that's one advice that anytime I'm speaking to med students or graduation things, I say, that's my advice. Always just say, I'm not going to hang up on it. I'm not going to beat myself up about it, because that can just drain you. But instead, just say, I'm just permitting any, no matter how big or how small. But the forward thinking is exactly what you mentioned, which is just think about your future self, and that person got better because of the, whatever the mistake was. You said you listened, on an exam when you didn't, or whatever the case may be, you guessed when you shouldn't have, etc.
It sounds like you have a very healthy relationship with your past and future selves. And based on studies now, we know that those who have such a relationship, they procrastinate less. They say no much more often when they should actually say no, not to have like future commitments they didn't want in the first place. But I liked so much that you said about making a mistake or failure in general. That's why I started going to a chess teacher like 5 years ago, because I found that in science or in the profession of being a researcher, you will make mistakes like 90% of the time, and the 10% will end up being a scientific paper and, part of your scientific career. But as a very competitive person in sports, and I'm trying to be a high achiever, I've had a awful track record at dealing with failure. So I thought there should be language, like a common language that I should start dealing with or start spending time with, through which I will learn how to fail properly. And chess is the perfect place, because even as an amazing player, I'm not one, but even as an amazing player, you will win more than, half of your games, but you will lose almost half of them. And when I think I've played like 20,000 games online, I've won more than I lost, but it still means that I lost at least almost 10,000 times. And every single time I put all my brain power and efforts into it. But simply by going to a chess teacher and learning all these concepts in chess and playing all the time, and sometimes losing against like 5-year-old kids in person, which is a great thing to, reduce your ego in general. I think I've learned how to fail properly, how to make mistakes, because normally, and that's why I watch baseball too, because even the best player, the average betting average is about 0.34, which means, 6 out of 20 times they will have a success, but for 14 times with all their efforts, it's going to be a failure. So whatever we do, I think as scientists or researchers and physicians, it makes a lot of sense to not get ready for failure. There is no pessimism here, but just to learn how to take it like an absolute everyday part of our jobs.
They're all braces. Like it's the braces. That's the point, is like any kind of failure, any kind of whatever, still has made you a better, person or self in the future. It's just like the braces do. For the same reason I did MMA, I did boxing first, and then I was like, I'm going to make this more challenging, and I just got destroyed through med school. I mean, I was so nascent, when it came to the ground game and some other things. But that future person was always just more able to, and then when you started like predicting the throws and knowing what to do and composing your emotion, so we could talk about it all day. There's a great that Roger Federer gave, and I think he gave some interesting statistic on how many points he actually won versus obviously the number of matches and tournaments. And it is shocking how narrow the points that he won versus lost were, or something to that effect. But it was when he won them and how like it ended up, he when it mattered, is when he tried most. But I have to pull that for later. But beautiful points. If I can turn the question a little bit, I love the ones that surprised you. My question is, and I guess, I would like it to be for the US healthcare system, but the healthcare in general, if there is one method, and I know that doesn't feel good, but if there is one method that you could introduce or think is most vitally important to get the biggest catalyst in healthcare when it comes to AI and technology, what do you think that method is, or what do you think that method is?
It wouldn't be a futures method. It would be a concept. And a concept is called patient design, which we published a paper about that. Which we mean by that is that you involve patients on the highest level of decision making. So if it's a healthcare government, it's the minister level. If it's an organization like the WHO, is the director level. If it's a company, it's the CEO level. But on that highest level, you have to proactively involve patients. And the US Food and Drug Administration has a patient advisory board for exactly that purpose. Because for me, just the idea that we people, working in and working for healthcare, organizing and designing processes and guidelines and technologies and products and services, how can we think that we can come up with anything useful, meeting real-life patient needs, without actively involve patients on the highest level of that decision-making process? That's what baffles me. And throughout my whole career, the futures methods, and including those futures methods into the way policy makers and decision makers design healthcare, that's about the last 2 years. But throughout the first 1.5 decades, my whole scientific career has been about searching for proofs on and making observations and publishing analysis about why patients have been the most underused resources of healthcare, not centuries, for millennia. Why the ivory tower of medicine didn't even allow them to contribute to the table. And the whole digital health revolution in the beginning of the 21st century, with the sensor revolution, the wearables, the smartwatches, the AI-based services, at-home lab tests, and all these, what these introduce as a change, as a paradigm shift in the healthcare system, is that patients can now contribute with their insights, their data, their opinions, their second opinions, their peer support, everything they can bring to the table. And this is simply an unprecedented cultural paradigm shift. That's why we always say that digital health is primarily a cultural shift, but a technological one, even though we always talk about advanced technologies when it comes to, the recent changes in the way we deliver healthcare. But as it's a cultural shift, we have to help the stakeholders understand how they can build relationships while using remote care services, how they can have a real-life conversation with a primary care physician and a patient, while an AI scribe is transforming that discussion into a medical record that the physician can check at the very end of the meeting. These are the changes that truly matter, instead of pinpointing a wearable sensor or an AI-based algorithm out there. And helping the stakeholders understand that there's a cultural revolution going on in which we have to provide you with all the help that you need to learn to use these technologies, to learn to build relationships while using these technologies. That's what really matters to me. And that's why I think patient design is the concept. If that I would have like a magic wand, I would install that concept or mindset everywhere around the world into healthcare governments, into healthcare companies, regulators, decision makers, because if that concept is in place, we can make sure that whatever technology or product or service we come with, it will meet a real life patient need.
I want to be optimistic, Bertalan, like about like that, how I can't even tell you how to begin to make that happen, unfortunately. And I think part of it is always this juxtaposition of, ROI, like immediate versus ideality. Like it's like ROI ideality. And I don't think people disagree on their ideals, but you have to, you have to make money, you have to like exist to be able to get there, is a kind of rock kicking down the road. But that's a different podcast in psychology, I'm sure.
No. If you don't mind, just let's spend like 3 minutes on this, because I don't want to persuade you to be optimistic, because I think you're optimistic enough. But I want to point out that we have gone through such a quick evolution just in the last 10 years about digital health that we should give technology a minute, to be deployed. But ROI is an important thing. And when we published about patient design, I got invited by a Dutch hospital in Nijmegen, a beautiful Dutch city, to show me what it looks like when they actually implement patient design. And what they did was they wanted to open up a new part of the facility, like a new wing. And before having the final design, they invited their chronic patients to have their voices heard. And in the final rooms, we can find like round tables instead of the traditional work desks that patients hated, because they were excluded from the discussion, from the whole process. But with the round tables, they could look at the same interface, look at data, and have a real life, discussion with eye-to-eye contact. And they also asked for a designated space in the same room with a blue duct tape. They showed that was the place, the bed, where a physician could examine a patient. And then I asked about the ROI, because I'm coming from, Eastern Europe, and we always talk about not having enough financials to implement innovations. It told me that patient satisfaction was skyrocketing. More and more physicians wanted to work in that room, because for them it meant less stress, less burnout, easier to work with such empowered patients who were confident enough to comply with the therapy. And at the end, it was an IKEA table and blue duct tape on the floor. That was the cost of implementing patient design. So ROI must be on the table, but in fact, patient design is more about an openness or flexibility, about mindset, rather than spending millions of dollars in introducing tiny changes to the design of hospitals, for example, that would lead to such incremental changes.
That is such a beautiful story, example. I'm so glad you shared that. That is encouraging. I am more optimistic now. Thank you. With that concept of this shared decision making and looking at everything in front of you, at least from the aspect of oncology, a lot of what we do is related to basically what does the data show? What kind of cancer type do you have? What's your sequencing? How's your hepatic function? You have cardiomyopathy, because these are all side effects of toxicities of different agents. And it's a monster juggle in parallel of independent factors and variables, trying to best predict an outcome that's favorable and avoid one that is unfavorable. A lot of what I just described, I'm sure, sounds like what at the core is behind the design of artificial intelligence: predictability, data, retrospective analysis to have the best outcome, or best predict what's next, like an LLM is with text. If you could have a multimodal approach in a clinical capacity. How do you see a physician's role play into, if not oncology, healthcare as a whole, the process? Are they the ones that see the future and know exactly how to balance these tools and make sure they're doing those things? Or is there some of that preserved in that decision-making capacity? Or is that going to be something that's replaced?
Let's start with a bit of a philosophical perspective. In that sense, I think every single task that a physician has today that is either repetitive and or data-based is prone to automation. Simply, the amazing expertise, the knowledge, the experience, the creativity, the judgment, all these are useless for a human being to solve those repetitive database tasks. And there are some medical specialties that stand out. We at the Medical Futurists did the first study diving into the vast database of the FDA in 2020 and finding out how many AI-based medical technologies they approved by then. We found 64 in 2020. And 1.5 years later, they published their own database dedicated to AI-based technologies. Now they have 1,500, even more than that now. And radiology, of course, is the clear winner of that AI race, but oncology and cardiology are the other specialties and emergency medicine that stand out. The philosophical perspective here is that not physicians should be replaced, of course, by automation. That's an absolutely useless discussion. But the tasks that are repetitive and database should be the ones that should be prone to automation. But the more practical view on this is that we cannot simply expect our physicians or healthcare professionals in general to learn to use a range of AI-based medical technologies, simply because I think it's physically impossible to learn to use all of them, when sometimes even the developers of those technologies cannot understand clearly enough why the AI comes up with good decisions because of how complex those deep learning solutions or methods are. So that's why we published a paper last year about why multimodal large language models could become the ultimate interface between healthcare professionals and using any kind of AI-based technologies. So just to take one example, we might have a physician working at a big hospital, and maybe they use an AI scribe, a voice-to-text application, by having a discussion with the patient that will transform the discussion into a medical record. Maybe they have a different AI from a third vendor in the EMR system, constantly analyzing that, mining the data for insights and information, even maybe diagnostic or treatment suggestions. There is one they use as a large language model for optimizing treatment plans. There is one AI being used by the radiology department. We cannot expect anyone to learn to use all these, but we can very much expect our healthcare professionals to learn one single skill, prompt engineering, just the ability to provide the best text-based prompts to ask the right questions to large language models. So these can act as the interface between them and all those AI-based technologies. They have to be able to ask that MLLM, multimodal large language model, here is an electronic medical record I just recorded or created with my patient after we had a discussion. But there is one part of it about the patient's previous radiology report that must be transformed into the format our department uses in radiology. Please do that. And it will do that. So prompt engineering, I think, is the most important emerging skill for healthcare professionals, because I have no doubts, based on at least the FDA's database, that the number of regulatory approved AI-based technologies will keep on rising, not exponentially, but incredibly quickly. But simply within the training of physicians or in postgraduate education, it's almost impossible to help them learn all of these. But it's very much possible to learn to use one tool with which they can have like human-to-human discussions.
That's not surprisingly, you absolutely kind of nailed it or illustrated how that intersection, can and will exist. And pardon my ignorance, but when you describe that, it's kind of how I think about Manus compared to ChatGPT. I don't know if you can comment on that, but I think there was a lot of this almost fitting into a box concept of agents and agent marketplace and but like Manus is really a great, in my opinion, or maybe I'm saying this incorrectly, example of forget all the details on if it's an agent, if it's not, just you have something, you can talk to it, and then it has its capabilities of executing in different capacities. Would you kind of say that's a similar thing or not really?
It is. It's a even more advanced version of that. So while I would be more than happy if I could say that all the healthcare professionals within a healthcare system, they know how to use an LLM, even not multimodal, just a basic regular large language model, because then I would know that as a healthcare leader, I will be able to deploy any kind of evidence-based, AI-based technologies that I can deploy, because I know that my healthcare workforce will be able to work with them. But fortunately, there will always be like the geeky percentage of the healthcare workforce that will want even more, because they will know how to take advantage of that. And there comes agentic AI, there comes AI agents that will start doing tasks for them. And that will simply not just, transform how we do research, how life science researchers gather, obtain data, and make conclusions and create hypotheses and all these, but even it can play a role in how we diagnose patients, monitor them on the long term, or optimize treatment plans. But we it's never fast enough how we can adopt these technologies. But let's just for a second be grateful for what we have already. Prompt engineering should be the first, a good enough first step. But then, of course, the window will be open to adopting even more technologies, agentic AI, multimodal models. So we are having few very exciting years ahead. Just last week, I was appointed. I'm not bragging here, but the reason why I want to mention that I will have. So last week I got appointed as professor in residence by the Royal College of Physicians and Surgeons in Canada. And the reason why I'm very excited about that is that I will be able to impact how more than 50,000 healthcare professionals are being trained and retrained for the digital health and AI revolution. So it's going to be a hell of a ride witnessing this, from the first line or the forefront of innovation, how such knowledge or skills or perspectives, patient design, how to work with patient empowerment, how all these concepts can be built into medical education, not in 15 years or 20 years from now, but right away. It's like changing the engine in an airplane that we are flying with right now. That's why it's such an exciting process.
That is incredibly exciting. Very well, deserved, but congratulations. I will be eagerly on the sideline listening to and seeing everything that is, analyzed with that process. And like you said, it needs to start now. If I can ask in 2 minutes, one last question, sadly, but this was amazing. How do you meet what Carl Sagan would call the folly of human conceits, when a physician or a group may say something like, "Oh, Sanjay, you're pretty bullish on, AI's capacity." I'm like, it's not bullish. This is realist. Like, we know what it performs at today. I'm not talking about what it will be, but even what it can do. How do you address that challenge? Because sometimes even 87 to 92% accuracy is still saying, well, it's only 87%. What about the other 13%? But we're not measuring what the accuracy is in X, Y, or Z from the human or the physician or whatever. I mean, is it going to take getting to 99% to actually adopt? Which goes back to the beginning of this conversation, my fear of just pushing something that can benefit if we're at a 40% rate systemically, until it gets to 99. How do you meet that?
I've been lucky enough to witness quite an evolution in that. So 15 years ago, giving a talk to at a medical conference to my peers, talking about this kind of future, patient empowerment, not even AI yet, just patient empowerment, the rise of digital health. I always felt like they actually told me, and they called me out, that it's nonsense, that it's the patient. What can the patient bring to the table? Medical technologies do, but other technologies have no place in the healthcare ecosystem. Patients cannot access anything besides what we physicians are giving them, and all these. Yet 5, 10, 15 years later, the same people keep asking me, and people like me, about, well, all my patients are asking such questions. They don't just use Dr. Google. Now they use Dr. AI and they use ChatGPT. So I'm on the same page, but I want to be able to help them. So witnessing this evolution, what I've learned is that I don't bring any emotions into the visions or trends I share with them. I think healthcare doesn't operate well enough, and it's not enough, for at least for my taste and for my standards. And I see what future visions and ideas and technologies could change that, but I don't bring any emotions into that, because instead of that, I want to understand why some physicians are rejecting change, why others are overhyping it. There are always emotional, cultural reasons, but at the end of the day, what must matter is evidence-based medicine. If I can show them, based on evidence, peer-reviewed studies and clinical trials, that the use of this or that technology, a digital therapeutic, a digital health sensor, an AI-based service, leads to better patient outcomes or improves their own job, better than any method on the market already, they have to comply with that, because that's how modern medicine works. If a medication has more evidence than the other, we will start using the new medication and ditch the old one. The same rules must apply for advanced technologies. I think it helps be in the process, because this way it's easy to describe what should be changed There is evidence for that. So please start using this digital health method, or start taking your patients as empowered patients and partners, because all the evidence leads to that. At the same time, it makes the role or the job of companies and organizations coming up with those technologies a bit harder, because even if a company comes up with the world's best invention in, medicine and healthcare, technology-wise, they still have to prove its worth, its safety, its efficiency through peer-reviewed studies and clinical trials. And this, unfortunately, or fortunately, it takes time. And that's why it's a long cultural evolution. But I just keep sticking to the rules of evidence-based medicine, and I hope my peers will do the same worldwide.
I love it. Show me the evidence, they say. Well, here it is. Dr. Bertalan, this has been an absolute inspirational, humbling episode, experience, and interview, and I'm fervently yours, even more so after this, if that was possible. And your map to the future. I have no words. You're amazing. Thank you.
That's very kind of you. Thank you so much for saying that, and I wish you all the best and success for the next 100 episode too. Just to have a future vision in mind here.
I love that. Thank you.